Engineer Dr. Lee Biwa.
Question 2, sir.
Mr. Speaker, sir, I'd like to thank Engineer Dr. Lee for raising this important question on behalf of our residents. Certainly share her view that for seniors who are suffering from incontinence, that we will encourage them to seek treatment early. We do not have data on the total number of seniors suffering from incontinence, as patients could be seeing their doctors for other primary conditions, such as urinary infection, prostate problems, or post-stroke treatment, which include treatment for incontinence. Mr. Speaker, over the past 3 years, around 2,900 seniors aged 65 years and above received subsidized treatment specifically for incontinence at polyclinics and CHAS GPs. This would be a subset of the total number of seniors seeking treatment for incontinence. Among this group of 2,900 seniors, those who received treatment at the polyclinics paid a median annual cost after subsidies of less than $10 in 2016. The costs and treatment required for each patient will depend on the nature and severity of his condition. Seniors receive subsidies of up to 75% when they visit polyclinics. Seniors who require further financial assistance after government subsidies may seek help from the medical social workers at our public healthcare institutions. Thank you.
Engineer Dr. Lee Biwa.
Thank you, sir. I would like to thank SMS for the comprehensive reply. I have one supplementary question. Besides treatment, I always think that preventive measures is better than cure. I would like to thank HPB for organizing many exercises nowadays in our housing estate. Perhaps there can have more talks during this exercise session, because incontinence will affect the quality of life, especially of our elderly residents. So I would like to ask whether there will be more awareness conducted by HPB so as to help more residents. Thank you.
Mr. Speaker, sir, I thank Engineer Dr. Lee for her supplementary question and for her suggestion. Certainly agree with her that prevention is better than cure. That is the approach that we take in the Ministry of Health. And the Health Promotion Board will be happy to work with our regional health systems, our healthcare institutions, to be able to reach out to residents in the community, to raise awareness, and to give talks focusing on prevention, on health promotion. So this is something which we will continue to work with our community partners, including our grassroots organizations, our community leaders, to reach out to our residents. Thank you.
Dr. Tan Wu Meng.
I thank SMS for his answer as well. In Clementi, where I serve, we have a number of elderly residents, some of who have shared about the cost of consumables that they need because they have incontinence. For example, adult diapers and other recurring expenditure items. Would MOH, either on its own or together with MTI, be willing to consider studying the cost of such consumables for patients with incontinence, and to see whether there are areas where these consumables might be delivered in a less expensive way? Thank you.
Mr. Speaker, I thank Dr. Tan for his supplementary question. And indeed, I think he's right that the help that we provide to our residents suffering from incontinence is not just for treatment, but also the other areas like consumables, diapers, for example. If seniors require adult diapers, they can apply for assistance under the Seniors Mobility and Enabling Fund, SMF. The fund provides means-tested subsidies, 50% or 80% subsidy for consumables such as diapers. So it will be something that we'll be happy to work with Dr. Tan and his team in Clementi to raise awareness and to reach out to his residents who require such assistance. Thank you.